Hi guys, Jess and Al here from thesitecollective.com, and we are doing a follow-up video on mindfulness today. Okay, so we've got two parts. There's one video where Al's teaching me, and for this one I'm going to teach him my take on mindfulness. All right.
Good.
So I see mindfulness again comes back to non-judgmental awareness and paying attention to just one thing at a time. But I also see that there's lots of different things that you can pay attention to. And while you gave a beautiful video on how to pay attention to thoughts, for some people and the patients that I work with, that's not always accessible. Sometimes their thoughts, it's hard for them to tune into their thoughts. Sometimes they don't want to tune into their thoughts, and they can be a really big experience of kind of dissociation or detachment. So I want to break it down into kind of the different levels of mindfulness, where what you did with the mindfulness of thoughts being kind of the top level, and ultimately where we want to get people to, but recognizing that you can also start a little bit lower. So you've heard of Maslow's hierarchy of needs?
Indeed.
This is Jess's hierarchy of mindfulness, okay? So what I'm going to start it off with here is awareness of your behaviors. What are you actually doing? So when Linehan teaches mindfulness, so Marsha Linehan, developer of dialectical behavioral therapy, she teaches it as what and how skills. So she looks at the what skills: observe, describe, and participate. Now for the mindfulness, I see this as behavioral participation. Pick an activity, engage in it, and give it your full attention as you're doing it. Okay. Now this can pretty much be any sort of behavior you like, and I like this one as a starting point because it's outside of your body. If people are experiencing high levels of distress, if they've got urges, whether it may be self-harm or using a substance or some form of addiction or something where it could lead to or engage in a problem behavior, and having an awareness of what's going on inside their head is too overwhelming, having an awareness of what's going on outside their body can feel a little bit safer. Okay, so mindful participation at a behavioral level is about doing something with full attention.
How does one maintain their attention if they're really distracted by what's going on? Does it need to be something
pick something you can, well, not even have to be complicated, because sometimes if you're too stuck in your head, then it's going to feel overwhelming. But pick something and give your full attention to it, and where possible I want you to try and engage the five senses, because then you've got different areas to kind of focus on: sight, sound, smell, taste, touch. Okay.
And are they doing, would you be recommending this as, so if you're feeling really overwhelmed, stop what you're doing, somehow recognize that you're feeling overwhelmed, stop what you're doing, and then have a behavior ready to go?
Yes. Okay. Yeah, that would be my recommendation. So my kind of top go-to, for anyone who knows me, cup of tea is usually my go-to. Now, sometimes it's just, I'm going to take a 5-minute break. If I'm at work, I don't have my full tea set here, but I can at least make a cup of tea. But it's notice the kind of the temperature of the cup when it's cold and when it's empty. Notice the sound of the water as it's pouring in. Notice the color changing in the water as the tea bag starts to seep through. Notice the smell of the tea if you've got some good stuff. Okay. Right? Notice kind of the color change again as you add the milk, and when you pour in the milk, it doesn't just change uniformly, it swirls around.
So it's a soothing behavior as well.
You can use it for that. So it can be used for grounding or self-soothing with the five senses. So pick an activity, give it your full attention. Mindful shower. If you're really distressed, go have a shower. Notice the sound of the water, the feel of the bubbles, the smell of the soap, whatever it is. Okay.
How do people maintain their? I mean, often yes, you can notice that, but then oh my God, there's all this other stuff going on. How do you suggest? It's going to
come back to the practice of just exactly as you've already said. You want to start to catch yourself when you bring your mind off, but rather than bringing it back to a particular thought that might be too difficult, you've got something tangible. Okay. So for some people, it could be building Lego. It's that gack or slime or whatever, where you can actually stretch it, and it's something you can hold in your hands. So something that pay attention to, something you can do,
something that can kind of generate enough attention that you can kind of maintain an engagement with it. Okay.
The next level I want you paying attention to is the physical. What is going on inside your body? All right. Now, while the thoughts themselves are going to be harder, we need to ultimately work up towards it. And for some people, it's actually noticing what's going on in your body. If you're comfortable, close your eyes. If not, pick a spot on the floor or the wall and stare at that, but do a body scan. Okay. Bring your attention inward, start at the top of your head, and just imagine there's like a laser beam being shone all the way down. Notice if there's any tension across your forehead. Do you have a headache? Notice if you're clenching your jaw. Notice if your shoulders are up around your neck. Notice what your heart rate's doing. Is is there tightness in the chest? Is your breathing really fast? Have you got nausea or butterflies in your stomach? Is your lower back hurting? And just bring your attention inwards to actually get to know your body and know what it is that you're doing.
Yeah, so a body scan is a really good way, because you can systematically go through different parts and can keep you engaged for a period of a number of minutes going through each bit. It's probably worth noting though that some people really can't tolerate doing a body scan. So some people who've had some sexual trauma and this kind of thing, often it's quite.
Pick some safer areas of the body.
Yeah.
All right. If there's certain areas that are off limit, that's fine. But find, is there a safer area of the body? Notice what's happening in your arms. Notice what's happening in your feet. Okay. Bring your attention to where you can, because ultimately there's a sense of mastery in regaining control.
I agree, and that would be a practice whereby you have a sort of set process and you work through a sort of routine, so to speak.
Yeah, and do it in a place that you're comfortable in, position, like body position that you're comfortable in, to be able to facilitate you getting to know your body again. Okay, and this is where you need to be applying that non-judgmental awareness of not kind of getting caught up of, oh God, my back hurts. Why does my back always hurt? I wish my back didn't hurt. But just simply notice there is a uncomfortable sensation in my lower back. Yeah?
Yeah.
Okay. Then we want to start to bring the attention to your emotional state. What is it that you're actually feeling? Right? And where you can, I want you to simply label it. So once you've done a body scan, that can be helpful because it can kind of pick up on clues for you. Kind of, my heart's racing, maybe that's because I'm anxious, or my stomach's kind of really nauseous, maybe that's because I'm feeling stressed, or my jaw is clenched and maybe that's because my mother-in-law has said something to piss me off and I'm going to bite my tongue, or whatever it is. But once you've got the awareness of the physical state, it can kind of lead you into an awareness of the emotional state. Now, for some people, they really struggle with this because they have what's called alexithymia. So alexithymia meaning no words for mood. So they struggle to be able to label their emotions or actually give some sort of description or definition for what it is they're feeling. The simple answer for that is kind of find an emotions list, and we can probably put one up on the website, or even the emotion wheel that's nice and colourful. And based on the intellectual definition of your awareness of what the word means, it's almost kind of a matching process as to, okay, here's a list of words. This is what's happening in my body. What's my closest approximation or guess as to what the best label is? And just with practice, you just kind of hone that in again.
Yeah, sometimes it can be helpful, I think, for people to have, you sort of, there's, if you like, there's base emotions and then there's deeper emotions. So, anger, sadness, fear, happiness as base emotions, guilt, shame, whatever is deeper emotions.
So I usually go with sad, mad, bad, scared.
Okay.
Starting point. Yeah? Okay. Then we want you to bring it to the cognitive awareness. Okay, so what is it that you're actually thinking? And something that can help with this, if you can't pinpoint it exactly, journaling can be helpful. Because sometimes you get so caught up and swept up in all the stuff that's going on inside your head that it's really hard to nut it out or to pinpoint it or to state it concisely of this is the thing that I'm worried about. And journaling can be a way of kind of getting stuff out and trying to process it and get it out. And then maybe you read back on it and go, okay, hang on, what I can see here is a theme around coronavirus or work anxiety or relationship problems or whatever it is.
Yeah, and so I guess it provides an opportunity to sort of crystallise the issues that are circling around in your mind.
Yeah. And then the metacognitive awareness comes back to the talk that you've already done. Check out we'll put this up on our webpage. It's already up on our YouTube channel. You'll be able to see what your talk is on the mindfulness of having the awareness that you're having a thought, or even more importantly, having an awareness of when you've kind of gone off track from the thought or the focus or the attention of where it was supposed to be. Yeah?
Sure.
All right. So this is really awareness of thought and gets into some of the stuff around thought diffusion.
Yeah, sort of awareness of thought and also I guess awareness of emotion. So kind of it does come into here, but you kind of need the labels. But
once you can do this, then you can do anything below it. But it's a bit of a hierarchy. So this could be a helpful starting point, and as you get better at it and more skilled, more confident, then we can be working your way up. Some people are going to be able to jump straight up here because they can just do it. That's beautiful. For other people, they're going to have difficulty accessing this. So we recommend they start here. Build their skills around attention and awareness and work their way up. Yeah,
if you're someone who's very prone to distress and emotionally kind of chaotic, you're definitely going to want to start down here. Starting up here would probably be too challenging.
Okay. All right. Good. So I want you to do a bit of a mini self-assessment. Where are you at in terms of your mindfulness practice? How well can you pay attention to each of these? What are some of the things that you could be doing? Do you need to practice some more self-soothing, grounding, 5 senses work? Do you need to do more body scans? Do you need to do some more labeling? As I said, I'll put up the emotion wheel on our website with this. Do you need to do some journaling to get to know what's going on inside your head? And then have a look at Al's other talk for around the metacognitive awareness. So that's just kind of thinking about thinking, basically what metacognitive awareness means. All right.
Good.
I'm done.
Thank you.
Thank you, guys.
Thanks,
check out YouTube, Facebook, Instagram, website. You'll find us around. We're from thesitecollective.com. Thank you.
Thanks.